Ethics Committee Group number 2. It is 11 a.m. on Friday, April 9th, 2021. We are here with hospital representatives, physician, nurse, legal counsel, community members, family, next of kin, son and daughter to discuss an ethical matter. I will now call this meeting to order. Our agenda is as follows. Introductions of our committee members present, the issue that we are discussing, review of the case scenario, patient's current medical condition, prognosis with given circumstances, family and member input, legal input, open discussion, final discussion. We will now go through our introductions.
I am Bri Reisenweber. I am the nurse.
I am Kelsey Holzbauer, and I will be the physician and acting chairman.
Sorry, I'm the oldest child. My name is Hussen Smith.
I am Cheyanne Smith. I am the youngest child.
I am Hanna Dugue, and I will be the legal representative. Sorry, it is not working today. I will now read the issue on hand. We will be discussing the ethical guidelines in determining the quality of life care for Mr. Smith. Mr. Smith is unable to make medical decisions for himself as he was put on a ventilator after his stats rapidly declined. Given Mr. Smith's prognosis, do we keep the patient on life support or do we remove the ventilator and provide end-of-life care? Mr. Smith's son wants to keep his father on life support. Mr. Smith's daughter feels her dad is ready to go peacefully on his own time and is advocating for that decision. I will now turn to Kelsey for our case scenario.
We have a 75-year-old patient, Mr. Smith, presented to our facility with chief complaints of worsening fever, cough, and shortness of breath. After an extensive workup within the emergency department and with comprehensive labs and chest x-rays, it was determined that Mr. Smith had an advanced COVID-19 infection that led to a rapid decline. He also developed progressive pneumonia, which caused his body to go into acute respiratory distress syndrome. With no advanced directives, the medical team promptly responded to his rapid decline, placing him on mechanical ventilation. Even with full life support, we are struggling to keep his stats stable. With Mr. Smith's advanced age and prior medical comorbidities, which include childhood asthma, a prior pack-a-day smoker, obesity, type 2 diabetes, hypertension, and atherosclerosis, his prognosis does not look favorable, as his past history and current condition puts him at a high risk for a poor outcome upon removal of mechanical ventilation. We will now take the time to thoroughly review the patient's medical history and current conditions with the family members and legal counsel to ethically conclude a final decision for Mr. Smith. We will now hear opening comments from the nurse.
I am Bri, the nurse on the ICU floor. I'm going to go through the SBAR, the situation, background, assessment, and recommendation. So we have a 75-year-old Tom Smith was admitted to the emergency department due to shallow, painful breathing. His vitals, he had 101.6 degree Fahrenheit temperature. His blood pressure was 151/83. He had a resting heart rate of 106 beats per minute. He had an increased respiratory rate of 26 breaths per minute, and his O2 was 87% on room air. After further assessment, Mr. Tom Smith had a productive cough and a bilateral lower respiratory infection. He was placed on supplemental oxygen. The patient's viral panel came back positive for acute pneumonia or active pneumonia and COVID-19. This patient was then moved to my floor in the ICU, where he has been placed in a medically induced coma. After 2 days, the patient's vitals are severely deteriorating despite multiple antiviral therapies. The patient became hypoxic, meaning he has low oxygen levels, and his oxygen saturation dropped from 84% with max O2 nasal cannula. His fever spiked to 103 degrees. 103.9 degrees. The rapid response team was called and the patient was put on a ventilator. 4 days post-admittance, the patient was further diagnosed with acute respiratory distress syndrome and remains in critical condition. My recommendation to the physician is that it's time to discuss the immediate next actions with the family.
Physician. Given his current state of well-being, the medical evidence is depicting less than favorable chances. We are currently learning day to day the effects in which COVID-19 has on the body. What we do know is that COVID-19 primarily affects the lungs, which is what we are seeing in the case of Mr. Smith. We have been going through all the new treatment protocols for COVID-19 infections, such as antiviral therapies with little to no improvements being seen. In fact, Mr. Smith also developed another highly invasive lung infection, which is pneumonia, an infection of the lungs which causes inflammation within the air sacs as they are filled with pus, not allowing oxygen to reach the rest of the body. As a result of his condition, he rapidly declined. We were then forced to place him on mechanical ventilation, a machine that works by pushing oxygen into the patient's airway when they are unable to breathe adequately on their own free will. This is usually a result of compromised lung function due to their severe injuries or infection, which would be COVID-19 and pneumonia for Mr. Smith. Mr. Smith requires this machine as the extensive damage to his lungs from his infection has rendered him unable to breathe efficiently on his own and is unable to supply his organs and tissues with the needed oxygen to survive. Mr. Smith currently has everything working against him. With his advanced age alone, he is at an 80% risk of death due to COVID-19. But with his obesity rate, diabetes, hypertension, and prior smoking history, which inevitably already caused substantial lung damage, his chances have greatly increased. Due to the extent and severity of the damage currently seen on Mr. Smith's X-rays and CT scan, I have also concluded that he has gone into acute respiratory distress syndrome. The excess of fluid has compromised lung function, leaving his body unable to receive the oxygen it needs. Even though he is currently on 100% inspired oxygen, his O2 stats are still below the levels in which we would expect and like to see. To combat this, we had to place him on positive end expiratory pressure in conjunction with mechanical ventilation to maintain his airway pressure above atmospheric level by exerting pressure that opposes passive emptying of the lungs. In layman's terms, this works by forcing the oxygen into the bloodstream so that it can travel throughout the body, reaching vital organs and tissues. Unfortunately, even with all the necessary interventions, his condition still remains critical and he is gradually deteriorating. With poor lung compliance, I'm afraid that we will soon be expecting to see multiple organ failure in Mr. Smith due to the lack of sufficient oxygen making its way throughout the body. It is also important to note that due to a lack of mobility, Mr. Smith will also be at a high risk for skin breakdown such as pressure ulcers, which will allow a portal for additional infections created by bacteria that have a high potential to develop into bacterial sepsis, which is a life-threatening condition that will create an immune response, causing the body to attack its own organs and tissues. Now, I know I threw out a bunch of big, scary terminologies, and it must be scary, but please know it is not my job to scare you. I am just here to ensure that you have all the information you need to make an educated decision. Recovery is not out. Just know that even with the slightest bit of chance, Mr. Smith is looking at a long journey due to his advanced age and extensive damage we have seen. At this time, do you have any further questions for me?
What does COVID recovery and aftercare look like?
Your dad may still experience shortness of breath and difficulty breathing even after recovering from COVID. There can also be some cognitive defects. Mr. Smith may experience muscle weakness and have some difficulties with basic day-to-day activities as well. Cheyanne, I know you have previously been assisting your dad in some aspects of his daily activities, and we cannot be sure how much more help he would or wouldn't need. Due to the stress of being in the hospital and isolation from loved ones, some patients do end up with post-traumatic stress disorder. All of these are really case specific, especially since our knowledge about COVID is developing day to day. Your dad may also need to see multiple therapists to include respiratory, physical, occupational, and speech and language therapy.
Okay, thank you.
As a reminder, before a decision is made, it is imperative that we approach this using the 4 basic principles. Medical indications using the principles of benefits, balancing the benefits of treatment against potential risk and costs associated, and the principle of non-maleficence, avoiding causation of harm. Right now, medical evidence is indicating a less than favorable outcome. We need to consider this when deciding if the benefits outweigh the risk. Patient preferences using the principle of respect for autonomy or respecting the wishes of the patient. Currently, the patient has no advance directive in place. We must discuss presumed values and wishes of this patient with the family members present. We also need to consider quality of life using the principles of benefits, non-maleficence, and respect for autonomy. Due to the extent of damage done as a result of the infections, Mr. Smith is looking at a prolonged stay in a high dependency unit as he will need round-the-clock monitoring. This can pose a huge financial burden for the family. Extended ventilation periods also have the potential to do more harm than good. The likelihood of a full recovery is slim. Even so, with his advanced age, Mr. Smith will ultimately require placement within a skilled nursing facility to assist with his activities of daily living. Lastly, contextual using the principle of justice or the obligation to treat all equally, fairly, and impartially. It is our duty at this facility to respect wishes made, ensuring fair treatment no matter the final decision that is made.
After hearing the evidence presented by both the nurse and the physician and taking into consideration the principles of an ethically sound decision, I would now ask that the family members present what they want done in regards to Mr. Smith's medical care and why they believe it is the best choice for their father.
I am Hussein, the older son of Tom Smith. I want to keep my dad on life support. I believe that keeping him on life support can give him a chance to survive and gives him a chance. Giving him a chance is really important to me. I understand this could be really expensive and I'll cover the medical expense. My dad still has the chance to fight and I believe he could overcome this. Just grant him that one chance to fight for his life. My dad is tough as a nail and also is a tremendous fighter. I'm not ready to say goodbye to dad yet. We plan to travel the world together, visit places like Rome, Paris, London, and all the 50 states. We always used to talk about going to NBA basketball playoff games. I want my kids around him when they're grown. I want him to tell my children stories. I'll do whatever needs to be done to give him a chance to live.
I am Cheyanne, the daughter of Tom Smith. I know him best. I've been there with him the whole time, and I know that he would want to be taken off the ventilator since there's such a low chance of survival. Dad is very strong-headed, and I know he wouldn't want to have someone taking care of him 24/7. I think we also need to take into consideration how much money this is costing to keep him on the ventilator in the hospital. Even if we decide to continue this and he does survive, there are going to be extra costs and after treatments and checkups. I think it's harder for all of us to watch him like this. I know it's harder for me since he's gotten sick, and I think it would be best to take the ventilator off and let him go peacefully.
Today, we need to help the family come to a decision that best follows what Mr. Tom Smith would have wanted in regards to his care. Mr. Tom Smith has no living spouse, but has 2 children, Hussen and Cheyanne. They have become the surrogate decision makers for Mr. Smith. I will now make sure that I have everything straight as far as what Hussen and Cheyanne would like to see happen with their father. Hussen, you want to keep your father on the ventilator, promising to cover the medical expenses of this decision. And you believe that your father would want to be given every possible opportunity to make a recovery. Cheyanne, you believe that your father wouldn't want you to see him this way and would want to remove the ventilator and provide end-of-life care. Is this correct?
Yes, that is correct.
Yes.
All right. So both of you believe you are acting in the best interest of your father, which from what you have said, we can all tell that you both love him dearly. If we fail to come to a decision here today, we will have to look at taking this to court. There you will have to make your arguments in front of a judge. From the decision made there, one and only one of you would become your dad's appointed medical proxy. If you want to go this route, it can be expensive and take time, which I'm sure you wouldn't want to waste. Plus, I have seen it create a lot of family issues that go beyond what we are here to discuss today. I believe that a fair solution would be keeping your father on the ventilator for X amount of time, and if no improvement is made, then we remove the ventilator. Does the physician have any words in regards to ventilation with COVID patients?
Yes, with the ventilator, there's a chance that Mr. Smith would be able to come off of it. The rate of patients who come off of ventilation is higher than what we thought at the beginning of COVID and what the media portrays. Less than 38% of COVID-19 patients who have required a ventilator have died. On the other hand, with continued ventilation, Mr. Smith is at a higher risk of further infections, as I stated prior. If he is on a ventilator long-term, we may have to perform a tracheostomy procedure where we will cut into the front part of his neck to insert a tube into the trachea to allow for proper ventilation. This will create communication barriers with Mr. Smith as a tube is inserted below the vocal cords. In my experience, it is extremely difficult for family members to see patients in this condition.
We will now open this up to family discussion.
Cheyanne, you're arguing the cost, Cheyanne, but I'm willing to pay for the treatment and any other care that might arise.
Fine, you would cover that, but do we want to risk them having to cut into Dad's trachea and him not being able to talk with us? Dad loves telling stories and listening to himself. Do you really think he would want that?
You have a point there, but the doctor also said less than 38% of COVID patients don't come off the ventilator and die. I believe that can be one of the 62 that recovers from this.
Dad has a lot of underlying conditions though, and he is older. That will make a difference in whether or not he will be able to come off ventilation.
Approximately how long are patients on ventilators before they have to cut into their trachea?
It changes case to case. Some patients come off ventilators in a few hours. Others are on it for multiple weeks. It varies from patient to patient. Because of this, I can't give an exact idea of or when if we would have to do this.
Well, Dad has already been on the ventilator for 3 days, but has not shown any improvements.
I don't think he will. Hassan, he is too old and has too many underlying conditions.
Don't you want Dad to recover?
Of course I do. I just don't think he'll be happy with the quality of his life if he were to recover.
Can we at least give him some more time to make improvement?
I think that sounds fair. What if we give him another week to improve?
A week makes sense to me. I think that gives him a fighting chance. The past 3 days we've given him so far.
So based on the conversation we have had here today, I believe that we have been able to come to an agreement for all parties involved. Mr. Tom Smith will remain on the ventilator for 7 more days from today's date, giving him a total of 10 days on ventilation. If there is still no improvement in that time period, hospital staff will remove the ventilator and provide end-of-life care. Do both parties agree to this?
Yes, I
Yeah.
think that's fair.
Okay, I think that is our decision then.
It is at this time on April 9th, 2021, I will call this meeting to an end. Thank you all for your time and participation.